Next, Neetu. Neetu, are you ready for a speaking session? You can type your name, Neetu Sajikumar. Yes, sir. Okay, Neetu Sajikumar, number 4. Neetu. Now, second one is going on. Number 4 will be Neetu Sajikumar. Neetu Sajikumar is a regular student. Yeah. Yes, ready. So, Sissy, hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we have a nurse, Agatha Okobo. Yes, Agatha, you can start.
Okay, good morning, sir.
Good morning, nurse.
Oh, you're welcome. Please, how may I address you?
You can call me Ben Johnson is my name, so you can call me Johnson.
Okay, Mr. Johnson, you're welcome. Please have your seat.
Thank you very much, nurse.
Okay, so I see you came here for information about insulin administration.
Actually, nurse, I have an appointment. Okay, so I'm a little bit worried about this one. I don't know why doctor has suggested me insulin injections because, you know, I am managing very well, excellently well with my diabetes diet, medication regimen, and exercises regularly. So then why does the doctor want to change my medication plan?
Okay, I do understand your concern, but presently the oral diabetic you were using have not been so effective. So as of today, your sugar level is still very high. But insulin is fast and is effective. So that is why he's changing from oral medications to an injectable. Do you understand that?
Yeah, of course, I understand. But is it very important? Is it compulsory for me to change the style? Is there no other treatment plan?
At this point, the only effective way it's the insulin administration. I do understand your anxiety and concern, but once you start, you do well with it. Okay?
Okay, nurse.
Okay. Yeah, so what you have to do now is when you want to take the insulin, you know that the insulin is fast.
So, nurse, let me tell you, I just don't really like the thought of injecting myself. I don't think I'll be able to do it. I cannot manage because I'm scared of these things.
Okay. Mr. Johnson, I understand. I totally understand. But I just want to let you understand that for now, what will be more effective for your diabetic control is an insulin administration. So, but just bear with us, just let's do it for a while, and I think you feel better. The needle pain is there. I feel your anxiety. I know you're anxious about the needle pains. So, but please, let's just manage with it for some time. Okay?
Yes, nurse, but okay. So if there is any other manage to manage my diabetes, if there is another way to manage my diabetes, I'd be very much thankful. But of course, if there is no other option, what can I do? So I understand. Yeah, whatever you're telling, I can understand. Come on. So explain me, nurse, what am I supposed to do now?
Okay, that's fine. So now, before you administer the insulin, you have to clean the site of the injection. But first of all, you check your sugar level. Make sure you have something to eat, please, because the insulin is very fast in absorption. And once you take it, make sure you have something readily available to eat. Do you understand, sir?
Yes, nurse.
Yeah, the insulin goes fast into the bloodstream. So, but when you want to take the insulin, check your sugar level. After checking your sugar level, then you withdraw the insulin in the syringe, clean the sites. Possibly you can use your arm or your stomach. But please, any points you use, The next time you want to administer the insulin, don't use that same point. You can go around a particular area, maybe your towel or your upper arm. Okay?
Yes,
So you
nurse.
don't use that particular point to avoid abscess. Do you understand? Then just pinch the skin a little. Let your needle be at angle 45 degrees, 45 to 90. Then you push the insulin in. You get to the point?
Of course.
Or before the insulin administration, there are some safety techniques you have to follow. Number one is make sure you wash and dry your hands. Let your hands be clean. Then before you administer the insulin. Do you understand?
Yes, nurse.
Okay. So I've told you that you have to rotate the site of administration while taking the insulin. And please, after the insulin administration, the disposal of the needle is very important. Please make sure the needle are disposed in a shaft box that will be provided. Let them be disposed appropriately. Do you understand?
Yeah, of course, nurse.
Okay, then one more thing. To maintain the potency of the insulin, once this insulin is not open, please, they should be kept in a refrigerator. But the ones that are open, please, they should be away from sunlight, because if there is sunlight, it will affect the potency of the insulin. Do you understand?
Yes, nurse.
Okay, do you have any question to this point, sir?
Yeah, of course, I have. And okay, I am ready for these things. But after using these insulin injections, I mean, the syringes and the needles, what am I supposed to do with them? Should I preserve them and reuse those things, or what should I do?
No, please. Like I said earlier, a shaft box will be provided for you. After each use of a needle, please dispose them properly into the shaft box. And once they are full, just label as full and keep at the side. Then you can use another. Maybe when next you're coming to the clinic for proper disposal, you can bring the full shaft box along so that it will be properly disposed. Do you understand, sir?
Yeah, of course, I understand them very clearly.
Okay, any other question?
Yeah, that's very nice, nurse. You have given me a lot of information. Thank you once again for your kindness.
Thank you, Mr. Johnson.
Okay.
Bye.
Bye. Right. Now I'm giving you some feedback. Listen to me very carefully. You need not make any points now. Already it is recorded on the YouTube, so you can just go through them and you can make the points and write them. And you can see that these will not be repeated. The mistakes will not be repeated, and the suggestions will be implemented. Number one, mistakes should be avoided. What all suggestions I tell in those, the mistakes, if I point, avoid those mistakes. Number one, avoiding mistakes. Number two, suggestions are given, so implement the suggestions. So these are the two things which you have to know. And additions, anything important things I will tell you in addition to do what. So you have to add those things. So three things. So
okay.
Right. Implementing the suggestions and additions will be provided, all these things. Number one, you are very confident. The confidence level is extremely high. So no problem regarding your presentation. Presentation is wonderful, right? And subject knowledge, you have absolute depth of subject knowledge. So that's the reason why you are talking with regarding everything, degrees, positioning, and how to do it, the process, step by step. Everything is very clear enough for the other person to understand. It's not just passing on the information, but reception of the information is very important. Passing of the information is from your side, but the reception on the part of this listener is very important. If you cannot convey the message properly, the other person cannot understand it very clearly. Therefore, you have to maintain that the other person can listen to it. Yeah. Next one. No panic, no confusion. The idea is clear. No panic on your part. You did not get confused anywhere. Right. The next one, steps, the measures. the step number 1, step number 2, what you should do first, what you should do next. Everything is explained very systematically. And then the one problem with you is, do you understand? It's an easy cake for you. It's an easy cake for you. So I don't want you to use the do you understand every time. So next time I should not hear the word do you understand. Avoid that. Totally avoid that.
Okay, sir.
Never repeat. I don't want them. Even one time, I don't want you to use this. Do you understand again? You use some other phrase, because this is an easy cake. You have told almost 7 to 8 times. You have told almost 7 to 8 times. So this, do you understand? Do you understand? Do you understand? It's not fine. It's it's ridiculous. So you should not do that one. You should not do that one. Then next one is you have to focus. You have to focus on repetitions, avoiding repetitions. The next one, fluency is well maintained. Okay, fluency is well maintained. Accuracy is sound. Grammar is fine. I have no doubt regarding your grammar. 80 to 85% or maybe 90% your grammar is excellent. But I don't want 100%. I want 200%. So what you can do is take 2 or 3 sentences and join them together, and you can make one mega sentence like simple, complex, compound sentence. If you have any problem, you come to me, because I will suggest you the necessary modifications. So if you have any problem, one sentence, you come to me. Another sentence, I will give you necessary suggestions or modifications. That's the third sentence. If, then, because. So using these words, conjunctions, markers, linkers, conjunctions, markers, linkers, pointers, use all these things and join the sentences. Is that clear, Agatha?
Yes,
Okobo?
sir. Yes, sir.
So I want you to implement all these things. Okay, where are you from? Nigeria, right?
Yes, sir, Nigeria.
Okay, fine. That's all for today. The next one will be, I'm stopping the live stream. Your video is recorded and it is on the YouTube. You can take it afterwards. I'll send it to the